Hi, I warmly welcome you to my YouTube channel. In this component of my presentation or video, I will focus on the second part of a peptic ulcer disease. Check through for part one on this very channel so that you can connect well to this presentation. I will consider the management of peptic ulcer disease, critically focusing on the diagnosis and the treatment thereof. The management of peptic ulcer disease, starting with diagnosis, it's important that you take the history. History will reveal a lot of issues. For example, if the patient has been abusing alcohol, if they have probably been taking maybe drugs which are non-steroid inflammatory drugs. So history is also critical in that it may reveal the type of diet the patient might have been taking. It also usually indicates to us as clinicians the timing and the severity of the pain which the patient is experiencing. So the first thing to jot down for those who are preparing for examinations, you need to take the history. History taking becomes so paramount. Secondly, we need to do a physical examination. Physical examination, we know it has 4 techniques. And these techniques include palpation, auscultation, percussion, and of course, inspection. So physical examination will review a good number of issues. Endoscopy, the first endoscopy that can be done, it's an endoscopy which will help a clinician to visualize the esophagus, the stomach, and the duodenum. And therefore, this endoscopy is known as esophagogastroduodenoscopy because it is visualizing 3 portions of the gastrointestinal tract. Then apart from that, this patient can also be subjected to spatial radiology, and this spatial radiology is barium swallow and barium meal. Barium swallow usually will focus on visualization of the upper part of the gastrointestinal tract, and the barium meal will help in visualizing the lower portion of the gastrointestinal tract. Stool examination, just to detect the presence of blood, which could have been digested, and this is now known as occult blood. Biopsy, if you want to rule out any tendencies of cancers developing. What could be the best drug or treatment to be given to this patient? Let's consider the aims. The first aim is to provide pain relief. Secondly, to eradicate H. pylori infection, to heal ulcerations, to prevent recurrence of peptic ulcer disease. On the treatment, usually this is triple therapy, which is commonly used, is an eradication therapy. So the first line of treatment will include the use of a proton pump inhibitor and a combination of 2 or more antibiotics, and apart from that one, a mild painkiller. The first drug in this combination is omeprazole, which is given in the dosage of 20 milligrams BD or twice daily for 4 to 8 weeks. We won't consider the side effects and everything. Secondly, we have amoxicillin, which is an antibiotic, and usually this will block protein synthesis. This is given 3 times daily orally. Then apart from that, we'll have metronidazole, which is 400 to 500 milligrams orally. Now, let me just focus on this. The presentation of metronidazole flagyl is 200 milligrams. So since we are discussing an adult, this adult will be given 400 milligrams. The 500 milligram presentation is usually reserved for an IV intravenous form of metronidazole. So this is very important. Then second line therapy would include bismuth, 120 milligrams, 4 times daily, metronidazole twice, tetracycline. Then the other antacids that would be very important to add would be magnesium triacetylate, which is chewable, but of course with a precaution that it may just lead to constipation. Histamine receptor antagonists, these ones, they'll block histamine secreted acid, therefore they're effective in the management of these conditions. Metadine 400 milligrams BD could be the drug of choice. Mucosal barrier fortifiers, of course, they can be given if they are available. The nursing care, we focus on relieving symptoms and promoting healing. Want to reduce anxiety at all means, maintain nutritional requirements, want to provide knowledge about the disease and its management, and we basically want to prevent complications. Again, thank you for watching this video, and watch out for part 3 of the details on nursing management of a patient with peptic ulcer disease.